Infertility risk factors in female. Age. Are you over 35 age? Age is an important infertility risk factor in female. Unfortunately, you cannot control it. After 35 age, woman's fertility potential starts to decline. After 40 age, the chance of getting pregnant sharply declines. The aging process decreases the number of eggs, quality of eggs, and the eggs become more susceptible to chromosomal abnormalities. Women after 35 age have higher risk of miscarriage too. Smoking. Do you smoke? Smoking can serious infertility risk factor. Fortunately, you can control it by stopping. Because smoking can damage fallopian tubes and cervix, therefore conception become more difficult. Smoking can decrease the egg supply, age the ovaries at faster rate than the normal, and bring about menopause early. If you do get pregnant, studies show that smokers have higher risk of miscarriage and premature birth. Obesity. Are you overweight? Weight is typical infertility risk factor in female that can be changed by improving diet and lifestyle. Overweight can lead to higher levels of estrogen in your body, which can disrupt normal ovulation. Overweight women often have higher levels of androgen as well as insulin, which can disrupt ovulation, therefore hard to get pregnant. Nearly 5 to 10% of weight reduction of total body weight can increase ovulation by 50%. Are you underweight and do you have any eating disorders? The women who are underweight are hypoestrogenic, which means they do not produce enough estrogen to ovulate normally. The underweight women are unable to produce enough hormones to trigger ovulation, which is essential for conception. The eating disorder like anorexia can also lead to abnormal menstrual cycles and infertility. Do you exercise excessively or are you lacking to do exercise? Studies have shown that excessive or strenuous exercise can also lead to irregular periods or no periods at all. So it is common for professional athletics, dancers and runners to have ovulation problems. Also, the lack of exercise can cause metabolic disorders like obesity, PCOD, thyroid disorders, which can lead to infertility if left untreated. Do you have history of STDs? STD, which means sexual transmitted diseases, such as gonorrhea, chlamydia, are common infertility risk factor which can lead to PID, which means pelvic inflammatory diseases, if left untreated. PID can result in complications such as scarring, miscarriage, ectopic pregnancy, and blocked fallopian tubes, all of which can adversely affect your chances of getting pregnant. Do you have irregular periods or spotting and bleeding between periods? Ovulation is essential for getting pregnant. If you don't have periods or your cycles are more than 35 days or less than 25 days, then you may have an ovulatory disorder, which is the leading cause of female infertility. The abnormal bleeding or spotting may indicate uterine or cervical problems, uterine polyps, uterine fibroids, and hormonal problems. Do you experience pain during menstruation, that is dysmenorrhea, or do you experience pain during sexual intercourse, that is dyspareunia? Pelvic pain indicate pelvic inflammatory diseases, tubal disease, endometriosis, and fibroids, all of which can negatively affect your fertility. Do you have history of recurrent miscarriage? Recurrent miscarriage can be caused by structural abnormalities of uterus or fibroids. Uterine infections, low hormone levels, and dysfunction of immune systems can also trigger the recurrent miscarriage. Do you drink excessive amounts of coffee or alcohol? Consumption of excessive amount of coffee have been linked to endometriosis and recurrent miscarriage. Alcohol or drug abuse have been shown to increase your chances of getting ovulatory disorders and endometriosis. It can also interfere with getting pregnant or carrying the pregnancy to the full term. If your answers are yes to any of these questions, then your fertility might be at risk. So, give yourself enough to make a difference. Improve your diet and lifestyle. Do moderate exercise like brisk walking, sun salutation, pranayam, and yoga. Do panchakarma like Vaman, Virechan, Nasya, Raktamokshan, Basti, and Uttar Basti. By all these things, you can improve your fertility. Thank you.